The treatment of adolescent idiopathic scoliosis, AIS, the most common form of childhood scoliosis, is non-surgical for the majority of patients, fortunately. This entails observation, in which the patient is monitored during the growth years to make sure the curvature does not progress or worsen. Observation is done with a physical exam and usually with an X-ray. We also use a new special technology that uses light instead of an X-ray, and we call that ScoliScan, in which a topographical map is created of the patient's back with precise calculations of the body's contours performed by a computer and giving accurate and reproducible information. The advantage is that we can follow patients without X-rays in many cases. Only a handful of centers around the United States have this technology. This is the area in which light is projected off of the, what I call ScoliScan. It's the Deers photometric system. And the light bounces off the patient's back and then is read through this camera and then fed to the computer, which does these complex surface calculations. And again, we can follow patients over time with this technique. We have also some patients who require a brace. And this is an example of a brace. This is an external plastic shell that is placed around the patient who has a curvature of more than 25 degrees and is still growing. And the idea of the brace is to press on the spine and correct the curvature when the patient is wearing the brace in order to prevent the curvature from worsening. The patients wear the brace anywhere from 14 to 20 hours per day, depending on the size of the curvature, the age of the patient, and the remaining growth of the patient. We have excellent data, excellent literature in the medical literature that shows that bracing is effective. A recent multi-center bracing trial called BRACED was funded by the National Institute of Health and really proved that bracing is effective in controlling curvature and preventing progression or worsening to a surgical range. We have many, many success stories of patients who have done well without their curves progressing. But it is not always effective, and some patients will require surgery to correct their scoliosis in the future. And some of those surgeries can be done with a non-fusion type of surgery, the fusionless option. We also have a newer approach to non-surgical care, and that is scoliosis-specific exercise therapy. One type of that is the Schroth method, which has gained much enthusiasm in our patient communities. It may be beneficial in slowing curvature. It certainly has been helpful in improving body alignment and posture, and it can improve and decrease patient pain.